cervicogenic headaches, tight necks, TMJ from stress, that kind of thing. Generally things that don't show up on x-rays and MRIs are what I see in here. I pushed on the right buttock, brought that back down into alignment, boom, the guy's pain was gone immediately, confirming to me that that was the cause of his pain. Only doing this with me because his wife is making him type thing because he had given up. Sometimes you got to back off a little bit in rehab, I find, and give the patient, if they flare things up, give them a chance to let it calm down. Rehab is already an up and down process, a waveform. Instead of going like that, I find it goes like that, and sometimes we have to stop. Okay, you went into a full-blown back spasm. All right, stop, shut it down for 1 to 3 weeks until you're back to baseline. Don't do anything. Hey, everybody, what's up? Physical therapist, Dr. Whelton, coming to you from just outside the beautiful Tampa Bay area. If you're new to following me, I have a chronic pain clinic, and I have learned to get exceptional results within that patient population. Most of the patients that I see in here are very frustrated with the medical system. They have tried, a lot of them will come in and say they've tried physical therapy, chiropractic, injections, surgery, MRI, acupuncture, you name it, massage therapy, whatever, they tried it. And I see a lot of the same things, usually mechanical issues throughout the day. SI joint, sacral torsion, sacral shear, rib head misalignments. I see what I refer to as stress injuries, cervicogenic headaches, tight necks, TMJ from stress, that kind of thing. Generally things that don't show up on x-rays and MRIs are what I see in here. Anyways, I have all my courses online. I have my Rehab results course, which is my orthopedic protocols, which is what I do in here. I have exact sets, reps, exercises that I do with my patients. I put that all online. I have my Myofascial course where I identified connections in the human body that you stimulate in certain joint angles and angles of pressure. And they support the relief of pain and gets me out of jams all the time. I love using it. I used it today and got a guy's hip pain gone like that. And then I have my sciatica cervical radiculopathy course that I use for sciatica and cervical radic, which helps me relieve my patient's pain. And I have my business course, but I also have this membership that I am launching. So if you want to join it, go to my website, wheltonmethods.com. And my goal is I'm teaching live with live Q&A where people can ask me questions. And I'm going to teach diagnostics, how I diagnose and how I treat. And you get massive discounts on my courses by signing up for this. Actually, more discounts than you would anyways. And you get part of this community of awesome clinicians that that want to get better at being a rehab professional for their patients. So I'm super excited about that. Anyways, my paper was accepted for publication on carpal tunnel syndrome. My paper I just wrote on carpal tunnel syndrome. I also outline trigger finger, medial lateral condylitis, and de Quervain's. And I give you simple protocols that I use that help my patients there. So you can go to my website, wheltonmethods.com, for all my papers, my publications. Let's see here. So today I am talking about a patient that I just had that I use a myofascial referral technique that helped me out of a jam with this patient. So this patient actually has been doing great. He had SI. So when I met him, he had, if you read my paper, I outline my diagnostic procedure for SI is when he extended back, my left thumb translated superiorly and my right thumb dropped down inferiorly. So I pulled on his leg, brought that back down, then gapped open the out flare of his pelvis, because in that paper I propose, if you read it, that SI joint dysfunction is caused by an upslip and or out flare of the pelvis. I have an SI joint clinic. I do this all day long with patients. And so I realigned it. I pulled it back down and gapped it open. And then he also had a sacral torsion. So when he bent forward, my left thumb dipped in. which told me he had a sacral torsion. So I pushed on the right buttock, brought that back down into alignment. Boom, the guy's pain was gone immediately, confirming to me that that was the cause of his pain. Now, this guy's had pain forever and tried like all kinds of things, completely frustrated, only doing this with me because his wife is making him type thing because he had given up. So anyway, so I am plugging along with him and we're making good progress. We got to the point where both thumbs are dropping when he comes in, when he extends back, and or the prone press up test, no more positive prone press up test. So the upslip, if you read my paper, the upslip I brought down, and then in his sacrum is in alignment. Both of my thumb, one doesn't dip when he bends forward or extends back. They are equal. Okay, so he doesn't have the sacral torsion anymore. But when I have him, he still has pain in his back and here. And when I have him do a standing ball squeeze and extend back, boom, the pain goes away. So he fire his adductors here, open it up, and boom, his pain goes away, which tells me that that's what the residual thing is, which I find usually with my patients, is that it's usually groin weakness with them after about 3 to 5 weeks is the issue. So if you read my paper or take my online courses, the Rehab Results course, I go over how I strengthen the adductors because it can be kind of tricky. I call that the straggler in this rehab. But so anyways, he was doing great. And then the next thing you know, he came in today limping. And I'm like, are you limping? And he said, yeah. I said, my hip hurts. So in my head, I'm like, number one, could this be SI? So here's my coloring of SI joint referred pain chart. Notice how it goes into the foot and into the groin, in the genital region. I even wrote that. I republished my papers. If you read them at wheltonmethods.com. If you've already read them, read them again because I put more in it. The journal let me go back and add some things. So anyways, I thought it might be the hip. So I opened, so he didn't have an upslip. I asked him to extend back and both of my thumbs dropped, translated inferiorly, like they should have. So he didn't have an upslip. So I had him squeeze the ball again, like I normally do when he comes in. And he did, and the pain in his mid-back went away, the residual pain, but he still had this pain in his hip. So I was like, well, that's not SI because I can't relieve it by realigning your SI. So I start pushing on his hip, and he's like, oh yeah, right there. So he's got some bursitis in there. I find that's very common. I wrote it up in that paper on SI. I believe it was SI that I published, which you can read on my website, and propose that you see bursitis a lot with SI joint dysfunction from gluteus medius weakness. But he also is, I think, 58. So, and he's worked on a farm, like kind of his whole life type thing, very active. So you can't rule out arthritis, right? So I can't rule out that it's not coming from an arthritic hip that he flared up, like bone spurs or something like that. Because I find that normally, like people with that, a lot of times they do the ab and adduction and they can flare it up when it gets to be severe arthritis. When the orthopedic surgeon says, you need to get your hip replaced. That level of arthritis, that's what I'm talking about, not some little bone spur type thing. So I had deduced that it was coming from the actual hip, musculature in here / joint, right? So anyway, so I put them on, I'm very holistic. I use electricity on acupuncture points. I don't just use electricity, I use it on acupuncture points. If I'm going to stimulate the body, I'm going to do it, theoretically help it heal, right? So I cover the points in my VIP inner circle. And so anyway, so I stimulated those. He got up and he felt a lot better. And then what I did was my myofascial referral technique to relieve his pain in the hip. So I stimulated different areas of the body that I mapped. You can take those courses. I mapped them, and boom, he got up and he was like, yeah, no, I feel great, So what I told him to do is to back off. So I had him do the ab and adduction because those are usually the culprit, I find, ab and adduction. And they both kind of heard it. So what I told him to do for abduction, I told him to do just one set of 30 if it didn't hurt. and back off a little bit. And then for adduction on that side, sometimes when you lay on it, you can irritate, especially I find when they have arthritis. He's like, yeah, it hurts when I do that. So I was like, okay, well, lean forward, because that often helps, I find. And opening up the SI biomechanically. And he's like, no, that hurts more. So I was like, okay, well, lean back. And he's like, oh, that's better. So I'm like, okay, we'll do it that way. Okay. And I'm like, back off for a little bit, let this thing calm down. You flared it up, and then we'll move on from there. Okay. So sometimes you got to back off a little bit in rehab, I find, and give the patient, if they flare things up, give them a chance to let it calm down. Otherwise, you just create a perpetual fire. Annette, can you come here for a second? So I'll show you what I did with him, and also how I diagnosed I was checking for hip arthritis. I didn't see, well, a little bit. So stand right here for me, please. Everybody know the Vanna White of physical therapy. Face that way. So I put both of my thumbs right here when he came in today. So he came in today with a hip pain, limping, and he's been doing great. So my question today was, okay, so if you come in with hip pain, is it actually referred pain from your SI joint? Could be, let's find out. So if you read my paper that I published a diagnostic procedure that I found SI to be upslip and or out flare cause. So I had him extend back, and no upslip today. So then I just put a ball between his knees and I had him squeeze. And I said, arch back for me when he squeezed the ball. And his pain relieved here, but he still had pain over here. So then I started touching in here, and he's like, yeah, no, that hurts. And I'm like, okay, well, we're dealing with a localized hip issue, right? So he flared up his hip. So lay on your back for me, please, Annette. So I cleared his SI, and I gapped open his out flare, and no relief of hip pain. Relieved his back pain when I did it bilaterally. He bilaterally gapped it open, but it didn't relieve his hip pain. So I realized that I was dealing with a localized hip issue. So he's 58, very active, worked on a farm basically his whole life type thing. So I wanted to see whether this was arthritis. So the way that I diagnose arthritis is I go like this and I look at the person's face. And when someone has arthritis, if you notice, and you jam them into internal rotation at 90 degrees, I notice that their eyes light up. And a lot of times they'll say, oh, it hurts in here or here or here, the same type of symptoms. And he did say that. So I was like, well, we really can't rule out arthritis. So I put on, that I cover in my VIP Inner Circle, I put on E-stim on acupuncture points that connect to his hip. He got up and he was like, oh, wow, that's a lot better. And then I used my myofascial method. You can take online. I used my myofascial method, and boom, got the rest of it come out of his hip, and he walked out feeling great. So I told him to cut down on the sets and reps and let it calm down. Some people, I tell them to stop the exercises if they go into a full-blown back spasm. I find you just can't push through that. Like if someone can't stand up and their back wrenches, I'm like, I'll see you in 1 to 3 weeks. It happens. It's happened to me twice in my life. Like you just can't push through that type thing. But this wasn't that bad. He's just having some hip pain, maybe an exacerbation of some arthritis in his hip, maybe the bursa. So I had to modify it. Lay on your side, face that way, please. And I told him, instead of doing your 3 sets of 30 for abduction on my SI protocol, just knock it down to 1. If it bothers it, knock it down to nothing, and we'll just take a break from it. And then face this way for me, please. And then I had him do this, and for the action to see what was bothering it. And he said, well, when he lifted his leg up and down, go ahead, lift it up and down. He's like, oh, that hurts. So then usually I find when you bring their hips forward, that it opens up their SIs and they can do it. And I said, go ahead and do that. And he's like, oh, no, that hurts more. So they said, okay, well, let's find a happy place here. And we tilted back inside lying. And I said, go ahead. And he's like, yeah, I can do that. I'm like, okay, do that. But let's cut back on the weight and just let this thing calm down while still trying to strengthen it. So I don't want to lose the time to strengthen it if it's not prohibitively so. But what I find is that if you continually put the person into pain, you're going to end up in a spasm found over the years with my patients, and then you have to stop. Okay, so I don't want to do that. I don't want to irritate things. As a general, as a general rule of thumb, I don't, except for like frozen shoulders and post-surgical rehab, I don't put people in contractures, stuff like that. I don't put people in pain because I have timelines, like my papers I published or my rehab results, orthopedic protocols. I have timelines that I can kind of set a watch to when my patients, start noticing a difference and get better, stuff like that. And I find that those timelines shift. So when I put someone in pain and tell them to push through it generally, as a general rule of thumb, there's some exceptions, I find that those timelines shift on me. And therefore, what would have been a 5 to 8 week rehab just became a 12-week rehab because the person's so flared up that it's just not helping the cause, So anyways, the other one would be rhomboid spasms. Like when someone has a rhomboid spasm, I think I covered that in my shoulder paper or in my online rehab results course, but in rhomboid spasm patients where they have that pain right in here, that gnawing pain, I've had that. It actually shocked me how bad that hurt when I got it. I tell those patients you're going to be sore for about 3 weeks because the reason why it hurts is because it's so stretched out and weak, and that we have to strengthen it. And if you strengthen something that's pissed because it's weak, then it's going to get aggravated. But I find usually with my patients, it'll take them about 5 weeks with rhomboid spasm to strengthen that up on my protocol. So anyways, that's that. So, I'm happy that I was able to, get them out of pain and give them relief. I was not happy that this patient came in limping today. And I had to do a differential diagnosis of whether it was SI, whether it was SI referred pain, whether it was bursitis, whether it was an irritation of some kind of hip arthritis that I didn't know about, whether he strained a muscle, So, and my synopsis is that we irritated the hip, musculature, doing the exercises, and also probably irritated the bursa too. I mean, you can never really say for sure. And he may have some hip arthritis. 58, been active his whole life, working on farms. The thing about people that do that kind of stuff, landscapers, people that work on farms or whatever, is they usually can't give it a rest. Like they got to take care of their farm, right? So they usually can't give it a rest. And when that happens, sometimes they can get into these cycles, I find, where they're just irritating. And it's just like, can you find somebody, that can help you, just so you can give it a rest? Because a lot of these conditions I find with my patients, I gotta give them a rest, like they have to rest, and in fact, all my patients, I'm like, if I could just keep you in a bubble for X amount of weeks and just rest and not do anything crazy, then, I could basically tell you what's going to happen. But if you can't, then rehab is already an up and down process, a waveform. Instead of going like that, I find it goes like that, and sometimes we have to stop. Okay, you went into a full-blown back spasm. All right, stop, shut it down for 1 to 3 weeks until you're back to baseline. Don't do anything, and then we'll start over again. And, so, I mean, there are even the gym rats that come in. They're like, look, man, I can't, I have to go to the gym. I have to. And I'm like, okay, I get it. I was at one point in my life, like, went to the gym all the time, that kind of thing. So I get it, but you could just be flaring this whole thing up. So we have this whole conversation about what exercises to do. I'll do a video on it one day. What exercises you can do, what exercises you can't do to avoid flaring it up. But I usually tell them you can take leisurely walks with SI up until the point of pain, not into the pain, up until the point of pain, A lot of times they feel better when they walk, I find because it loosens up, whereas it hurts to sit for a while and then get up, or it hurts to get out of the car after a long car ride type thing. Anyways, that's that. You can sign up on my membership on my website, wheltonmethods.com, or take my courses, massive discounts. Peace, love you all.